Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp me on 9226810630. My dear friends, we are taking the series continuous video series for more than 50 plus videos related with Ayurveda in GP, Ayurveda in general medical practice. We are not talking about hospital management. Okay, so today's topic is skin diseases. As this topic is big topic, I have divided this topic into two parts of the video. So this is skin diseases part 1. So let us start to discuss the various skin problems that we face in general medical practice. These skin diseases are scabies, ringworm or fungal infections, leucoderma or vitiligo, eczema. Can you see on the screen, please? Acne, that means acne vulgaris. Can you see the screen, this my cursor? Please note the cursor. Then urticaria is like allergic skin rashes, recurrent boils like formation, dandruff, head lice, pruritus ani, and corn and wart. These are the important topics that we discuss in these videos. Let us start with the scabies. In Ayurveda, all the skin diseases are categorized or taken as a kushtha vikar. Kindly write down the word of Ayurveda. For any skin disease, the broad classification title in Ayurveda is Kushtha, Kushhtha. My dear friends, in Marathi language, Kushtha has a different meaning. Kushtha is a leprosy as per the Marathi colloquial language, but Ayurvedic terminology is different. So Kushtha means all types of skin diseases. Ayurveda believes that the main problem in the skin disease is Rakta Dhatu. The quality and quantity of Rakta Dhatu is not proper. Rakta Sarata, the Ayurvedic terminology, Rakta Sarata is not good, bad Rakta Dhatu or the blood. Also, why this only blood is a problem? No, there is another problem, that is Pitta Dosha. The properties of Pitta Dosha for all types of skin diseases, you must understand this concept of Pitta Dosha. Pittam Sasneha, Tikshna, Ushna, Laghu, Vistra, Sara, Drava. I am sorry, my dear friend, little Sanskrit, because we are talking Ayurveda in GP, not only modern science. So, Pittam Sasneha, Tikshna, Ushna, Laghu, Vistra, Sara, Drava. So, whenever the Tikshna, Ushna Guna, Pitta Prakopaka food, Pitta Prakopaka, Pitta vitiated type of lifestyle, then there will be problem in all types of skin diseases. You will develop skin diseases, or if you have any skin disease, and if you are doing Pitta Prakopika food and lifestyle, your skin disease will not be get cured. So my dear friends, take into account that Pitta Dosha and Rakta Dhatu. We have to do the Pitta Shamana, not too spicy, too irritating, too hot, vices, alcohol, smoking, tobacco, everything is bad. You're hot-tempered, jealousy, extra ambitions, bad for skin diseases. Too much mental stress, bad for skin diseases. All skin diseases are mostly, although there is some infection part, still this is psychosomatic problem. Always there will be involvement of 1% to 100% of your mind. Tensions, anxiety, depression, everything will be incorporated in the skin diseases. So be careful. Only anti-infective, only anti-allergic is not sufficient, my dear friends. You must understand little bit Ayurveda. Of course, I agree. Whenever there is infection, it may be fungal infection, it may be bacterial infection, one has to give the antibiotic antifungal, I know that. But still, Ayurvedic approach is also important. Okay. Scabies in Ayurveda, it is called as a PAMA. So it's a different word, na? Yes, PAMA. It is a contagious disease, one person to another, in the whole family members, PAMA, scabies, caused by a mite. Forget about that particular name of that particular mite, but Sarcoptes scabies. What is the name? Sarcoptes scabies is a mite. Disease is spread to the contact with the infected person or through contact with infected clothes, bed linens, or towels. So when the person is in the, any child is in the family having scabies, that particular child's towel, child's clothes, child's bed linens, all should be washed separately. Otherwise, all the other family members, this happens in the illiterate people. In the slum area, they don't know this type of the contagious. And then whole family members suffer from scabies. You know, here, scabies, lot of itching, lot of itching. Itching often severe and bad at night. Night itching will be more. Thin, wavy channels made up of tiny blisters or bumps on the skin. Scabies is found mostly in the skin folds. Can you see here? Skin fold. Always you will find that scabies lesions, PAMA in Ayurveda, here armpits, inguinal region, buttocks. So everywhere there will be scabies and itching. But scabies can appear on many parts of the body. In adults and older children, scabies is often found between the fingers, here and toes, and in the armpits. What should be given? In Ayurveda, there is Ayurveda Rashala company in Pune, Sukshma Triphala, like an Ayurvedic antibiotic, anti-mite treatment, 2 tablets 3 times in a day. Sorry, spelling mistake is there. This is not S, this is 3 times in a day. Gandhaka Rasayan, we always use the twin couple of the medicine, Sukshma Triphala plus Gandhak Rasayan. Sukshma Triphala plus Gandhak Rasayan. Gandhak is a sulfur. Okay, 2 tablets 3 times in a day. Printing mistake, excuse me for that. Maha Manjishtadi Kadha, blood purifier, 4 teaspoons with equal amount of water 2 times after meals. This is one prescription. Now the second, Dr. Deshpande in these videos giving the students and Ayurvedic doctors so many alternatives of the medicines that according to the patient's condition, the doctors can use this and that medicines. So you can use Pravala Pashtivati, that is anti-pitta, because pitta dushti is there, ushna tikshna gun is increased, so that can reduce that heat of the pitta. 2 tablets 3 times in a day. Kama Dudhavati, 2 tablets 3 times in a day. All, I think why I should not clear that, because we are friends. No, we are friends. So give me some time, my dear friends. 3 times in a day, I will make it in front of you, with you. Why not? We are all friends, my dear friends. So why not? You are always helping Dr. Deshpande. You are always supporting Dr. Deshpande. And here I can make a save, for example, in front of you, with you. Okay. And then again, I can go for that. Okay. Can you see now? Everything is perfect. Excuse me and sorry for, sir, why you not see before? My dear friends, I have to do a lot of work. One-man army is there. So, of course, Ayurveda Academy is there, but that is helping me another way. Okay. These technical things I have to manage by myself. Anyway, Pravalvati, 2 tablets 3 times in a day. Kamadudhavati, both are anti-pitta. Chandanadivati, sandalwood, 2 tablets 3 times. Sir, what is this HP? In many videos, I have mentioned this pharmacy, Hari Parshuram Aushadhalaya in Pune, from late Khadiwale Vaidya. His son, Vinayak Khadiwale Vaidya, near Raman Bagh School, is working with Ayurvedic managements and treatments and consultations. Mahamanjisthadi Kada, 4 teaspoon with equal amount of water. Can you see the cursor, my dear friends? See the cursor. 2 times after meals. Let us go ahead. Next prescription. Every prescription is different. Not all the medicines taken together. Sutta Shekhar. Whenever there is a Samapitta. What is, sir, Samapitta? Pitta. Increase of heat and hot. In addition to the constipation. In addition to the indigestion. In addition to the ajirna. In addition to the gas in the stomach. Then that is called as a Samapitta. Remember this word. Samapitta, then Sutta Shekhar tablet 3 times in a day. Again, there is one printing mistake. Can you again give me some time, please, my dear friends? Just a moment. 3 times in a day, then here 2 times correct. Here, I think I should give 2 teaspoon, okay? And then again, I will go back and say, save. And we will go again as a PowerPoint presentation, big screen. Okay. So, Sutta Shekhar, I think I have to go back. No, this has we have covered. Sutta Shekhar Ras 2 tablet 3 times in a day. Then Talakeshwara Rasa, specific for scabies mites. Baidyanath Company, 125 to 250 milligram 2 times in a day with honey. This is Kleda Nashana. Kleda is an unwanted fluid waste product in our body during the tissue metabolism. The Ayurvedic word is a Kleda, K-L-E-D-A, Kledanashana, destroying the excessive moisture, secretions, serous secretions, pus secretion, yellow secretion, green secretion, infection goes away. Talkeshwara Rasa. Then Sandu Company, Hemoclean liquid, 2 teaspoon 2 times in a day. Or Baidyanath Company, Rakta Shodhakavati, 2 tablets 3 times in a day. Local application of Kasisadi Ghrita, medicated ghee you can apply. Next, further, this is not repetition. For itching, you can use the Charak Company Purilla syrup, P-U-R-I-L-L-A, Purilla syrup, 2 teaspoon 2 times in a day. Then Rasamanikya Rasa, Kledanashana, anti-infective, 125 to 250 milligram with honey 2 times in a day. And local application here, rub it. Mahamarichadi Tail, local application. So many internal and external medicines Dr. Deshpande is giving to the medical fraternity. Okay. Or tablet Septilin, Himalaya Company, 2 tablet 3 times in a day. Then Surakta, Baidyanath Company, 2 teaspoon 2 times in a day. Gentle application of Ranashodhana Tail or Paribhadra Tail followed by hot water bath. That means before bath, before going, of course, hot means lukewarm water. Before going to bath, half an hour you have to apply in the burrows, that spaces of Pama or the scabies you have to apply. Keep it for half an hour and then go for the bath. Now, scabies, Pathyapathya, regimen. Precaution has to be taken as scabies is always one person to another, contagious. Sansargajanya vyadhi, aupasargika vyadhi in Ayurveda. Sterilization of the clothes, cleanliness has to be done properly. See the cursor. Keep clothes dry. Never use the wet clothes. Even in the rainy season, take precaution. Cut the nails. This is common for all skin diseases. Never use wet, W-E-T, or dirty garments, clothes, undergarments. Contraindicated. Your skin disease will not be get cured if you are not following hygiene, if you are not following sterilization, if you are not taking care of the dampness, D-A-M-P, damp, wet, your skin problem will not be cured. Excessive sweating, clean it, make it dry, then only apply the external ointments or these things. Always cut the nails. In any skin disease, no nails should be increased. Then scratching, then auto-infection will take place. Avoid the itching. Next. Second skin problem. This is scabies is enough. Finish. Now ringworm or the tinea infection. Fungal infection. You know, fungus always grow in the rainy season on the walls, on the floor, green color. Similarly, whenever there is excessive clay in our body because of the faulty kapha. Remember my word. This is related with the kapha problem. Previously, it was little bit rakta dushti, pitta, etc. But this is kapha problem. And kapha prakopak ahar vihar. Excessive fatty substances, overeating, excessive sweets, obesity, diabetes mellitus will continue this problem. Tinea, fungus, always will be there, always. So you should reduce your weight. Diabetes must be under control. Fasting blood sugar 80 to 120 milligram, postprandial 80 to 140 milligram. Rather, I will say whenever skin disease patient will come to the doctor, I suggest minimum two investigations. Hemogram ESR number one and glycosylated hemoglobin or HbA1c to get the average of the 3 months blood sugar. Always check it. And also the stool sample for getting the worm infestation, roundworm, threadworm, tapeworm. You have to find it out. You must find it out. For any skin disease, I am telling this. Okay. And then always decide the prakriti of the person. That is more important. Okay. Superficial fungus infection. See the cursor. I will try to show you the cursor. Can you see? Cursor is moving. Cursor is moving on the screen. Fungus infection caused by the species of 3 genera of fungi: Trichophyton, Microsputum, and Epidermophyton. Forget. I don't care what is the name. Fungus is okay. Dermophyton fungi are found in the soil, also in the animals and in the human beings. They live on the superficial layers of the epidermis, hair, and also nails. Remember this. 3 things will be affected: skin, nails, hair. The factors that promote this growth of dermatophytosis are humid climate, clay, poor nutrition, immunity is low, and hygiene is not maintained. Then contact with the infected animals and the human. They can give to each other. Then debilitating diseases, chronic, the diseases that are making you weak. For example, you have the tuberculosis. For example, you have the cancer. For example, you have the HIV, AIDS. Then the chances of getting skin infections, especially fungal infections, very, very, very common. You have to take care that the original disease should be under control. Then you can treat properly. Next, ringworm of the body is related to the athlete's foot, that is Tinea pedis. Jock itch, Tinea cruris. Ringworm of the scalp, Tinea capitis. Ringworm often spreads by direct skin-to-skin contact with the patient with an infected person or infected even animal. A scaly, ring-shaped area typically on the buttocks, trunk, arms, and legs. Most common is itching pruritus, a clear or scaly area inside the ring, perhaps with a scattering of bumps whose color differs from red on white skin to reddish, purplish, brown, gray, any color on black and brown skin. So there is a difference. Slightly raised, expanding rings, a round, flat, patchy of itchy skin and overlapping rings. Here, I request all my patients, doctors, and students in fungal infection, tinea, cruris. Although there is a severe itching, please don't use prednisolone or visolone tablet internally. Especially don't use any steroid ointment on the fungal lesion. Don't apply any steroid ointment on the fungal infection skin lesion, because temporarily your itching will go. Temporarily you will be happy, oh my God, itching gone. But no, afterwards your fungal infection will again recur, and very bad. So fungal infection, Steroid ointment, for example, Betnelan ointment, should not be applied. This is very, very, very important suggestion for each and every doctor. Maybe Ayurveda, homeopathy, integrated, anybody. Okay, next. Investigations, as I am telling always, blood sugar, fasting and postprandial to rule out the diabetes mellitus. Each video I am telling you, fasting and post glucose blood sugar for not known diabetic. Not known diabetic. They are not diabetic patients. They are normal people. But if the patient is diabetic, then there is fasting and postprandial after food. It's not necessary to do the post glucose again. Okay. Treatment: thiostatin tablet from Ayurveda Rasashala Company, Pune. 2 tablets 3 times in a day. Mahamanjisthadi Gada, 4 teaspoons with equal amount of water, 2 times after meals. Rubiclin, Ayurveda Seva Sanganashik, 2 teaspoons 3 times in a day. Next, ringworm for local application, Hartal Mishrana. It was available few years back. I don't know right now it is available or not. Otherwise, you can take a recipe and prepare by yourself. Hartal Mishran is very powerful in my days when I was actively practicing physically at different hospitals and centers. So, Hartal Mishran from Ayurveda Shala Pune. Or you can have the Paribhadra Tail, oil means tail, or Karanja Tail also you can use. Pathya or the regimen, bloodletting, Rakta Mokshana Chikitsa is the best treatment in skin diseases from Ayurveda. Proper drying after bath and use of dry clothes is very important. Control the diabetes. It should be within normal limit, and obesity reduce the weight. Second, skin disease finished. Third disease, that is Leucoderma or white hypopigmented patches on the skin, vitiligo. Patchy, loss of skin color, melanin deficiency. Color giving element here, melanin, M-E-L-A-N-I-N, brown color. If melanin deficiency, white, which usually first appears on the hands and also maybe face areas around the body openings and genitalia. Premature whitening or graying of the hair on your scalp, even the eyelashes, eyebrows, or the beard also. Loss of color in the tissues that line the inside of the mouth and nose, mucous membranes. Vitiligo can start at any age but usually appears before the age of 30. Arogyavardhini is the best medicine to stimulate the whole metabolism and the action of the different hormones, because Arogyavardhini is a best liver tonic. So this is a Rogaha Sarve Api Mandegnu. Quote from Ayurveda. Very important statement from Ayurveda. Ayurveda believes Rogaha Sarve Api, from cold to cancer, they are because of the faulty metabolic process. And metabolic stimulator, best tonic for metabolism is the Arogyavardhini tablet. Never forget. Arogya is health. Vardhini, it is improving our health, improving our immunity, improving our metabolic process. Then Sarivadhyasava, blood purifier, 4 teaspoons with equal amount of water 2 times after meals. Then Sarvanga Sundara Guti, Ayurveda Rasashala Pune, 2 tablets 3 times in a day. Application of Bavachi Tail or Bavachi Lepa Gori and morning sun bath, tender sunlight, that means sun rays, that is 8 or 9 a.m., not of 12 noon, my dear friends. In even modern science, in allopathy, the specific treatment for leucoderma is, write down, PUVA, P-U-V-A, 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 PUVA therapy. So what is that PUVA? PUVA. P for soralin. P for soralin tablet. Here P is silent. P-S-O-R-E-L-E-N, soralin tablet. P for soralin tablet. PUVA, UV, means ultraviolet rays of the sun. Even the modern allopathic doctors, they ask the patient to take soralin tablet in the morning, 8 a.m., and sit in the sunlight for half an hour. The similar type of the procedure is Ayurveda following also. That means Ayurveda, of course, from the 5,000 years back, from the Charak time. Okay, Bauchi lep goli. Bauchi also contains orelin. Sun bath for 10 minutes. Pigmento ointment for application, and 1 tablet 4 times in a day. Pigmento is available in the ointment form, also in the tablet form. Then Khajirarisht, 4 teaspoons with equal amount of water 2 times after meals. Next prescription, my dear friends, for Leucoderma, Gomutrasava. It's a stimulant for melanin. Gomutra is the cow's urine. 4 teaspoons with equal amount of water 2 times after food. Local application of leech, Jalaukavacharana, best treatment for vitiligo. When there are small and limited type of the spots are there on your body, then you can apply leech or the Jalauka, Nirvish Jalauka. Best treatment for especially Leucoderma, if the proper training and facilities are available to that particular doctor. Once in a week, rest of the day application of the Bauchi Lepagori. Local application also there is a Shvet Kushthara Lep. Shvet Kushthara Lep is also available. Leucoderma, vitiligo, finish. Next skin disease, that is eczema. Okay, atopic dermatitis. In Ayurveda, it is called as a Vicharchika. Vicharchika. Okay, atopic dermatitis, eczema symptoms can appear anywhere in the body and vary different widely from person to person. For example, some will have the dry and cracked skin with lot of fissures. Then itchiness or pruritus, this is common symptom for many skin diseases. Rash on the swollen skin that varies in the color depending on your skin color. Small raised bumps or brown or black skin. Oozing and crusting also sometimes happens because there are 2 types, dry eczema and wet eczema, WET, dry and wet eczema. These are the 2 types. Now, many times when this disease is a chronic type and whenever the more months or more years finish, then the skin will be totally thickened and it is called as, please write down, lichenified skin, LICHEN, lichenified skin. Darkening of the skin around the eyes, raw sensitive skin after scratching because of the scratching. Atopic dermatitis often begins, can you see the cursor, before the age of 5 and may continue into the teenage and adult years also. For some people, eczema, this particular rash, flares and then clears up for time, even for several years. This particular condition is called as, in Ayurveda, Vegavastha. Sometimes bad days, all the symptoms are very much there. So this is called as a Vegavastha. Sometimes everything goes away. That is Avegavastha. Avegavastha. Good days. Bad days, good days. Bad days, DAYS, good days. Are you getting this point? Another word for this is relapse and remission. Relapse and remission. So this is a common tendency for some diseases. Eczema is not contagious. No. Inflammatory disease of the skin in response to the endogenous or exogenous stimuli. In Ayurveda, it can be called as ama because from indigestion. Characterized by the erythema. Can you see the cursor, my dear friends? Here, I am moving the cursor. Can you see the cursor? Erythema, that is a redness, edema, swelling, vesiculation, oozing, weeping, and crusting. These are the typical features of eczema. Now you will ask, what are the types of the eczema? Contact dermatitis, atopic dermatitis, circumscribed dermatitis, nummular dermatitis, infectious eczematoid dermatitis, and stasis dermatitis. The treatment, thyrostatin tablet from Ayurveda Rashala Pune, 2 tablets 3 times in a day. Mahamanjisthadi Kada blood purifier, 4 teaspoons with equal amount of water. Khadirarisht, removing the kleda because it is astringent in taste, 4 teaspoons with equal amount of water 2 times after meals. Local application, Kanchana Malam, Malam that is ointment. Another prescription for eczema, Sarivadyasav, Sariva means Anantamur, anti-pitta, Ushna Tikshnata will be come down. 4 teaspoons with equal amount of water 2 times after meals. Sapta Vimshanti Guggulu. Sapta Vimshanti Guggulu, specific Guggulu product for skin diseases, 2 tablets 3 times in a day. Rakta Shodhana, Ayurveda Arkashala, 4 teaspoons 2 times after meals. Another prescription, eczema treatment, Arka Neem, 2 tablets 3 times in a day, Ayurveda Arkashala, with milk, sugar and ghee. Local application of Hartal Mishran plus Paribhadra Tail for dry eczema. Now for the wet eczema, when there is a lot of secretions, serous secretions and itching is there, what we do, leeches application is very good. Jalavukavacharana Raktamokshana Chikitsa, Arogyavardhini to remove the clay, 2 tablets 3 times in a day. Praval Pishtivati to reduce the heat from the local area, 2 tablets 3 times in a day. Kamadudavati 2 tablets 3 times in a day. Then Rakta Shuddhi Kadha from Haripurshuram Aushadale, pharmacy from Pune from Khadiwale Vaidya, 4 teaspoons with equal amount of water 2 times a day. Treatment, Sutta Shekhara Rasa for Samapitta, 2 tablets 3 times in a day. Kanchanara Guggulu to reduce the lichenification. When the skin is thick, this Kanchanar will do the Lekhana Karma. Then Punarnava Guggulu with reduce the swelling and edema around that particular eczema, 2 tablets 3 times in a day. Then blood purifier, Kaishor Guggul. Kaishor is a Guduchi, Tenospora cordifolia, very bitter taste, Amapachak Dravya. 2 tablets 3 times in a day. Triphala Guggulu to reduce even obesity, 2 tablets 3 times in a day. Mahatiktaka Grita, best rasayan for many skin diseases. After the acute attack, Vegavastha relapse is over, then continue this Mahatiktaka Grita for 6 months, I will say, 3 months, no problem. 2 teaspoons with warm water 2 times in a day. Better way for rasayan early in the morning before breakfast. That is called as a Rasayana Kal in Ayurveda. Rasamanikya Baidyanath Company plus 50 milligram Sariva Churna. Sariva means Anandamul, 500 milligram. And this particular mishran you have to take 250 milligram 3 times in a day as Satana with honey. Local application of Isab or Gajakarna Malam available in Hari Parshuram Aushadhale, Pune by Vaidya Khadiwale Vaidya. Next, Pathya in eczema, regimen, proper hygiene, avoid contact with the soil, dust, terylene and nylon socks, use of Triphala Kvath for washing that secretion or the wet eczema. So my dear friend, this is all for the skin diseases part 1 in the series of Ayurveda in general medical practice. I am very much thankful for your nice cooperation. Please like, share and subscribe my YouTube channel, and I wish all the best. See you in the next video. Till then, I request all of you to continue your support for this particular channel. Thank you very much.